Hello, I'm coming to you today. Today is Wednesday, the 14th. Um, I'm sorry I didn't come back sooner, but I've just been really tired. As you can see, I got my bandages off. Um, I'm not really digging the scar, but it's only 3 weeks old, so it will get better. See, um, it is a little raised, which is to be expected. And right here on the edge, I can feel a little something hard. I believe it's still some leftover glue. Right here is where the drain was. Like I said, I've been using, I've been letting it breathe. And I've been using these types of bandages. They're called Scar Away. And then I just place it on my neck, usually at night every other day after I wash it and pat dry it. It's just supposed to help the scar go away. It's worked for my other scars on my body, but since this one's visible and I can't really hide it, I really want to get rid of this scar. You could see they put it in the fold of my neck. So eventually it should kind of like blend in. And then I also purchased bio oil. That helps a lot too for scars. I'm feeling a lot better. I asked my doctor for a better muscle relaxer so then I can get some sleep at night. I did take one when I got my prescription because I'm not taking any pain medications at all. I'm not even taking Motrin that much, every once in a great while, but I haven't taken it in a few days. But when I did take my muscle relaxer, I did not wear, I did not wear my soft collar, which this is what I usually wear at night. And it's real easy to put on, and it helps a lot. During the day, I don't wear it as much, but then at night, I can feel that I should have, so I just put it on every once in a while. If I'm not like sitting like this with a pillow behind my head and behind my lower back, just to help keep myself steady. But I do recommend it. It's uncomfortable to wear this at night, but I took a muscle relaxer and I did not sleep with this on at night, and I must have passed out, which I normally don't, because it really relaxed me. And when I woke up, I was in so much, I wouldn't say pain, but discomfort. My neck felt really, really sore. So I think when I was asleep, I was moving my neck, because when you're asleep, you can't really tell. So, and I know I shouldn't have been doing that. So now I'm back to wearing this at night because it does help. And my water pillow helps a lot. I do recommend you get a water pillow. But see, I can touch it now. It just feels really raised. Right here's like a little bump, but it's actually okay. I still can't feel anything right here. Like it's numb. I can feel right here, but like right here, it's still numb. Right here. Down here, I can feel. Sometimes, I don't know why, but this bone area, sometimes it gets a little sore. I don't know if it's because when they cut, all of the, the tendons and the muscles just affects it, but I haven't really been feeling that lately. You'll probably feel it maybe within the first and second week. I really don't feel it that much, but it's not bad. I also purchased one of these leg cushions, which is really helpful when I lay on my bed. I put my feet and then my legs go up right here, so it really helps. This is my water pillow right here. You can hear it. It really cushions, and it really helps to have the pillow this way because it helps keep your whole back straight, and it helps really a lot. Also, I purchased one of these long heating pads, so I just place that along the water pillow, and see how it's long, so it gets your lower back. You can position it however you want, your lower back, and then it goes all the way up, and it feels really, really good on the back of your neck because you're going to really need that. Let's see. And these are the Scar Away bandages that I purchased. I'm not really sure where I purchased them from because I used them for my last surgery on my stomach. And they are amazing. Just Google them, Scar Away. They have really good technology. And then these I bought on Amazon. They're just like little strips. I don't have the packaging, but they're easy to put on. And you just put them on right here and peel them off. And they do help with the, so when you're taking a shower, it keeps them waterproof. So when you do have your bandage on there, it protects it. And then when you're finished, just gently pull it off. It won't pull off your bandage when it comes off. And just gently pull it off and it'll come off, and then just dispose of it. You can get like 30 in a pack for like $10 on Amazon. Just look for any type of waterproof bandage that's big enough to cover your scar. It all depends on how big your neck is. They said my neck is very small, so these bandages are kind of huge. So they come like over here to over here, which isn't bad. You might as well, have better coverage than none. Also, what helps is if when you're doing your, when you first have your surgery and you have the bandages on, I recommend getting some type of face wipes. If you're a man, you can get face wipes as well. It's just, cleansing. There's just different types. I don't wear makeup, so those are the ones that I got. But it says it's like a makeup remover, but it also says it's a face wash. I didn't realize that they were makeup removers, but like I said, I don't wear makeup. So those helped out a lot. And, like after, you start feeling better, and you're not taking any more. I was off my pain pills on the 5th day because I was taking Oxy. It was 10 milligrams. They made me really nauseous, but I did need them because I was not in pain, but it was just really, really sore. And then I broke them in half to make them 5 milligrams. And then eventually on like the 3rd day, I cut them into quarters. So then I was just taking little pieces. And then finally on the 5th day, I was tired of feeling nauseous. Some people don't get nauseous with them. I'm glad that some people don't, but I do. So then I stopped them completely and started taking Motrin 800. And that was like for a few days. And then my doctor prescribed me my muscle relaxers, and then I was just using those to help. What I also suggest, if you're having a hard time sleeping, which you will, your whole body's going to get restless because you're constantly, you can't move your neck or your head. They have to be perfectly still. So like when I'm turning, I have to go like this or like this. So it's like, you'll start getting stiff in the back of your neck and right here on your shoulders, your arms and hands. Like mine were really bad. When I had my bulging discs, they were always numb, and I always had to do this with my hands because I could never feel them. So I've been doing this for so long that sometimes I tend to do it. And my husband's like, "Are you okay?" And I'm like, "Yes." I was like, "It's just out of habit." I do have arthritis in my thumb, so that is still hurting. So I got to go back to my hand specialist on that. But other than that, I have full range of motion of my neck. My um, neck and my back shoulders between my shoulder blades is not hurting at all. It's just, the tension. They said I have a very small neck, and the disc that they put in is a little bit big. So they said I asked them, why am I feeling so much tension in my neck? And when I went on my last post-op, they said that it's due to the disc in there. It's just a little bit taller, so it's actually stretching my neck. But after a while, after I start doing physical therapy and moving my neck up and down and side to side, and it'll start flexing, and then it'll start moving, and it'll go back down. So I can't wait for that. But if you are having trouble sleeping, I do recommend these Cervical triple action melatonin gummies. They do help me relax. But what I do suggest highly is to do a lot of walking, just so then you get, blood flow going to your legs and your body, because at night you will feel restless. Like sometimes I can't feel my leg, not feel them, but like it's just like they're restless, you know. It's like um, my husband's, uh, he got me this type of massager. This is wonderful. Um, I think he got it somewhere in the mall at one of those places, but you can just go online and find one. This is amazing. I can't do it up. Um, I really would love it on my shoulders, but I really can't do it on there because of the vibration. You're not supposed to have any type of that with this, but he does do it on my arms, my lower arms, and my legs, and it helps a lot. It feels so good. But this is usually the collar that you're going to get when you when you first get out of the hospital. They'll come and fit you. They recommended me wearing this for like the first week, especially if you go out to the store, which I don't recommend because you're going to hit those speed bumps and it's not going to feel good. Or when you're turning and you're on the medication, you're going to get motion sickness. I've seen some people post that they've been going out, going to dinner a few days after their surgery. I don't know how they did that. I'm just giving it to you straight that I would not recommend doing. Um, so how this works, I use this still sometimes. Like when I went to my doctor's appointment, um, I had this on and he was like, well, you know, if you really don't want to wear this, you know, you can wear the soft collar. But this, once you try it on, and you can wear it during the day too, because it just, you settle into it, and like all the pressure of your head, the weight falls on this. So it gets the tension off of your neck. And I really like this. So sometimes I will wear this regardless what the doctor said. It's just for my comfort. So you just gotta put it on like this. And wrap it around. See? So sometimes when I feel like, you know, because sometimes I'd be walking around my house and, you know, I have a dog, you know, I have my son, he's 12. My sister came out here, she's helping me. She always reminds me because sometimes when I'm doing stuff, I do tend to kind of like move my neck a little bit, but you're not supposed to. That, you know, messes up the healing process. So basically, I would suggest wearing this. It's funky, but you know what? Once you try it, you're gonna be like, oh, this feels so good. You don't have to wear it all day. Just like if you're getting up and you know you're gonna be doing quite a few things. You know, I've been getting my own food. You know, my sister's been cooking. I don't do dishes or anything like that yet, because you know you're constantly moving, and then your shoulders are already tense as enough as it is. So basically, this helps a lot. So see, you can see it from the side, you can see it from the back, from the side, and then right here. But it really helps a lot. I really like this, and I suggest if you are going out anywhere for you know, a little drive, you know, maybe to the store, you want to go visit somebody, go get your prescriptions, go to a doctor's appointment, just wear this in the car because it helps when you never know. You could be driving, you know, whoever's driving you, because I can't drive it. They're not allowing me to drive because you can't look. But anyways, when my sister's driving me places, and we go somewhere, sometimes it's just like a car will stop all of a sudden and she brakes, and I'm just like going like this. Luckily, I have this on because it's not making my neck move, because that can hurt the disc that's trying to heal inside you. So I recommend this. Once you get to your doctor's appointment, you can just take this off, and you can go ahead and just put the soft collar back on. This one, let me show you. So it's real easy to take off. You just gently take it off. See, there I moved my neck. Oh, that hurt. This thing was stuck on my hair, so it made me move. So this is the soft collar. I bought this off of Amazon. I think it was like $12, and it's a lot easier to put on. Just velcros, and you could wear this during the day during your house too. See, it's nice and snug. It rests your chin on here, so you're not like, so when you look down, you have to move your whole body to look down, versus if you're not wearing it, sometimes you tend to look down and it pulls and it can hurt. You don't want the disc moving out of its place, because it can. It has to heal properly. And then when I try to look, I'm looking side to side, and it doesn't allow me to move my neck, which is great. So I have to hey, like both ways. So I really suggest you buying one of these. I don't think, oh yes I do. This is the one that I bought from Amazon, the foam cervical collar. It depends on how big your neck is. If you have a longer neck, a wider neck, this one says 2.5 inches. So you may want to measure your neck to see which one would fit best for you. This one is like great. So see here, I don't know if you could see that clearly, but it shows the size chart, and they do have different sizes. So you can just find which one will fit you best. Also, the doctor, they will give you some of these. I suggest you ask for a little bit more. This is like when you first get out of the hospital. I was only in there for one day. It just depends on how your pain level is and how your body's reacting. These are wonderful. I just use these to give myself a little standard wash. Like I would wash my arms, my face. I'll use my cleansing things for that. But it would help out a lot. And then I also bought this. And always, when you're drinking something, drink from a straw, so you're not like lifting your head back to drink. Always use a straw. See, I'm even drinking coffee, and I have a straw. It's just so you don't have to use your neck to be mobile. Also, I bought this really cool neck pillow from Amazon again. Let me show you how it works. And this is great for when you're like sitting on the couch watching movies. Because sometimes this gets a little tiresome because I wear it all night long. So first thing when I take it off, I take this off. And then once they take the bandages off, I always try to let it air dry. You know, I always pat dry it